We are going to briefly discuss the role of working with interpreters in the healthcare system. Interpreters are individuals who've been trained to utilize various language understanding so that an individual provider speaking one language can appropriately communicate and assess a patient who speaks a different language. Medical interpreters play a very important role in the healthcare system. The use of medical interpreters can really help us achieve patient safety and health literacy goals. Medical interpreters can help providers receive informed consent from patients and can help strengthen cultural competence. Medical interpreters, when used in the healthcare setting, oftentimes leads to improved patient outcomes and reduced liability. Medical interpreters includes the use of language interpretation as well as interpreters for the deaf using sign language. There are many guidelines for training interpreters in the healthcare system. Individuals who are trained bilingual staff or those who have systems with on-staff interpreters like Family Healthcare Center would be appropriate use of interpreters in the healthcare system. Some systems have PRN interpreters. Some pharmacies have contracts with telephone interpreter systems that they pay for each call that they make. Sometimes there are trained volunteers that can be trained as interpreters. Note, this might be against policy in some institutions based on HIPAA requirements. Those who cannot be interpreters include family and friends, children under the age of 18 years old, other patients or volunteers, and untrained volunteers. Included here are some tips for working with interpreters for you as the pharmacist. Using an interpreter correctly is a learned skill. It takes practice. Remember to include introductions, introducing yourself to the interpreter if you've never met before, and then also introducing the patient and the interpreter will be very, very important. Acknowledge the interpreter as a professional. This person is an integral part of the healthcare team. When you're communicating, focus on the patient, not the interpreter. So speak to the patient as if you are communicating directly to them. The interpreter should be someone that is listening and interpreting that information, not someone that you're communicating with directly. Speak more slowly, but not more loudly. Speaking more loudly can be seen as intimidating or as if you are speaking down to the patient. Use an even pace with short segments. Resist having a full conversation and expecting that interpreter to remember everything that you said. Those short segments will be very important. Remember, every single thing that you say is interpreted, and everything the patient says too. Remember, some things cannot be directly interpreted. There might be some words that do not have an exact direct interpretation. Use frequent repeat back methods. Just like we learned about in P1 year in our communication content, that teach back method will be very important. Summarize information. In the next slide, we will watch a video regarding use of an interpreter in the healthcare system. Benefits of an interpreter and risks of not using a trained interpreter will be elicited. Pay attention to the communication strategies that the healthcare provider uses in order to maximize the benefit of the encounter.
$71 million. That's what the payout was for one of the most noted cases of interpreter error. A young Hispanic man in Florida became a quadriplegic because of one misinterpreted Spanish word, intoxicado. Paramedics thought the man was drunk. In reality, the word means something else. and his medical team failed to diagnose a brain aneurysm that led to his paralysis. If a qualified medical interpreter was made available, the outcome could have been a lot different. Medical interpreters are specifically trained in medical terms and follow uniform codes and protocols standard in health systems across the nation. They will respect patient confidentiality. They are trained to repeat everything the healthcare provider says and everything the patient says. They do not summarize, paraphrase, add to, omit, or change the meaning of words. Nor do they say what they think the patient or the caregiver means. As in the following example.
Ms. Rodriguez, I understand that your religious beliefs don't allow you to accept a blood transfusion, but this is a very big operation. There's a significant chance of blood loss during the surgery. If you don't consent to a blood transfusion, I'm afraid it could result in your death.
Dice que la cirugía es muy grande y si no aceptas la transfusión de sangre te podrás morir.
Yo no voy a aceptar transfusión de sangre. Eso va en contra de mis creencias.
She still refuses the transfusion.
Well, maybe we could try blood products. Can you explain to her that if she has significant blood loss during the operation, we could give her platelets or albumin?
Dice que te pueden dar parte de la sangre. Eso te podrá ayudar a parar de sangrar.
Nada de eso. Eso va en contra de mis creencias. Ya lo dije.
Entonces le digo eso, que te deja morir.
Sí, dígale eso. Por si todo va a estar bien. Sí.
She says she would like that. She says that everything will be okay.
So she'll sign the consent for the transfusion of blood products?
Yes.
Okay.
Firma.
Using family, friends, minors, untrained volunteers, strangers, or other patients may result in breach of confidentiality, may result in patients being reluctant to fully disclose critical information, increases hospital liability, may result in additions, omissions, and changes in meaning, may result in misinterpretation due to lack of medical vocabulary, and it may result in traumatizing children who are forced to convey difficult news to family members. Here's how the scenario you just saw would have turned out had a professional interpreter been used.
Ms. Rodriguez, I understand that your religious beliefs prevent you from receiving a blood transfusion.
Señora Rodríguez, yo entiendo que sus creencias religiosas no permiten que usted reciba una transfusión de sangre.
But I want you to understand that this is a very big surgery.
Pero la cirugía que le van a hacer hoy es una cirugía muy grande.
And there's a significant chance for a lot of blood loss during this operation.
Hay una gran posibilidad de que usted pierda mucha sangre durante esta operación.
And if you don't consent to a blood transfusion, I'm afraid that it could result in your death.
Yo me temo que si usted no acepta una transfusión de sangre, esto podría resultar en su fallecimiento.
No, yo no voy a aceptar una transfusión de sangre. Eso va en contra de mis creencias.
I'm not willing to accept the blood transfusion. That's against my beliefs.
Well, maybe we could try something else. If you have significant blood loss during the operation, we could try blood products like albumin or platelets. Would you be open to that?
Bueno, podemos intentar esto. Si usted tiene una pérdida de sangre importante, podríamos intentar darle productos de sangre como albumina o plaquetas.
No, nada de eso. Nada de eso. Eso va en contra de mis creencias. Nada.
Nothing like that. That's against my beliefs. Nothing.
No te puedes dejar ir así. Por favor, acepta esto. Si no por ti, por tus hijos.
No, va en contra de nuestras creencias y va en contra de la palabra de Dios. Nada, no.
Companion is saying, please accept this, if not for yourself, for your children. Patient is saying, no, I cannot accept this. It's against our beliefs and against God's word. So no, nothing.
A trained interpreter will want you to speak directly to the patient, looking at them as you communicate, and they will ask the patient to do the same. They will speak in the first person, and this will allow the caregiver to say, for example, where does it hurt, instead of ask her where it hurts. Trained interpreters ask caregivers to pause frequently, to allow the interpretation to occur without rushing, repeating, or mistakes.
Good morning, Mr. Victor. I did go through your blood work and imaging this morning. Your imaging is okay.
صباح الخير أستاذ فيكتور. أنا راجعت التحاليل والأشعاعات بتاعتك، الأشعاعات بتاعتك معقولة.
The blood work showed mild elevation in your liver tests.
تحاليل الدم أوضحت إن أنت عندك.
If an interpreter has a question, they will make it clear to all parties.
It can also cause esophageal varices and liver cancer.
وممكن أيضا تسبب دوالي في المريء وسرطان في الكبد. Excuse me, doctor, the interpreter would like to ask you to say that in layman terms so I can convey it to the patient in a way that he can understand it. أنا بقول للدكتور إن يقول الكلام اللي قاله بلغة عامية علشان أقدر أنقلها لك بصورة حضرتك تقدر تفهمها.
Esophageal varices is when there is.
And if they don't understand what the patient is saying, they will also inform the caregiver.
And that could be due to the underlying hepatitis C.
وده ممكن يكون بسبب فيروس سي اللي مسبب التهاب الكبد.
ازاي جالي ده؟
How did I get that? The interpreter would like to ask the patient, what does he mean by that? بتقصد ايه بده؟
التهاب كبدي؟
Hepatitis C?
Okay, hepatitis C is.
In some instances, the interpreter may ask the caregiver to elaborate if they feel the patient has not been given enough information.
Now, based on your physical exam, blood work, and imaging, you can safely wait till the new medication that's gonna be out next year.
بناء على الكشف عليك والتحاليل والأشعاعات أنا ممكن أقول إن حضرتك ممكن تنتظر it's okay في أمان لغاية السنة الجاية ما تظهر الأدوية الجديدة.
استنى السنة الجاية؟
Do I wait until next year?
Yes.
أيوة. Excuse me, doctor. The interpreter noticed that the patient is a bit anxious about the wait until next year. So if you don't mind to reassure him about the fact that it's okay to wait until next year.
Okay.
أنا لاحظت إن حضرتك قلقان على موضوع الانتظار لغاية السنة الجاية فطلبت من الدكتور إن هو يشرح لك أكتر علشان يطمنك.
Okay, hepatitis C does not progress that fast.
Remember, interpreting and translating are not the same. Interpreting pertains to spoken language, while translating applies to written documents.